All right, Bob, thank you. Well, there are some new exciting products and procedures in the world of cosmetic surgery that will soon be available to help you look better than ever. Joining us this morning is Dr. Jon Harrell from Century Center for Aesthetic Medicine and Surgery in Weston. Well, welcome.
Thank you. Well,
wonderful to have you here. And I want to jump right into it because I know we have a lot to get to, and it's want to get everybody up to speed on what may be coming soon.
Yes, absolutely. Well, there are a number of things out there that may be coming up in the near future, and some things down the pipeline. Since breast augmentation is one of the most popular cosmetic procedures, we have two items that we'll can cover today if you'd like. The first is the Gummy Bear implant. It's been dubbed the Gummy Bear implant. Yes, ma'am.
Okay.
Well, somebody had to give it that name, but really what it is a very cohesive gel implant. It's a silicone implant where the molecules stick together so much that if you were to actually slice the implant, it would stay solid.
Oh, wow.
And it is the 5th generation of implants that are made out of silicone. And the hope for benefits of this implant would be that it would reduce the chance of rippling or visibility of the shell under the breast of a lady, and that it might reduce the scarring and the contracture that happens in a small number of patients. Right now, they have completed a large degree of the clinical trials. It's with the FDA, and until the FDA says it's okay, the company really can't comment on where this process is, but we're hopeful that implant will be available to women here in the United States.
What is the difference between the Gummy Bear breast implant procedure and, would you say, other breast implant procedures?
I think the main thing is that because all of these implants are shaped in an anatomical form, that is, they resemble the curves of a breast. It's not a perfect round sphere or an ellipse. It has to be put in properly with proper orientation. And because the implants are more solid, it requires a slightly larger incision to negotiate it into the tissues and adjust it. So for women with smaller areola or for armpit incisions, it's probably going to be a difficult way to go.
Okay, what about fat injection breast enhancements?
Well, this is something that's actually been around for a very long time, but it was looked at askance back in the 1990s when it was being done. And I think a lot of that had to do with poor technique and the lack of understanding on how to either harvest graft or put it into the tissues that you want to put it into.
Okay.
Nowadays, what we found is if grafts are harvested in a particular way and injected in a particular way, that the rate of acceptability, the ability of the fat to live and stay there the way you want it to has increased significantly. One of the big concerns early on was whether it was going to create scarring in a lady's breast and whether that was going to interfere with the detection of breast cancer. The early evidence out now is that probably is not going to be a big issue, but it certainly is not a procedure that's out there in a great amount. But there are pioneers developing this, and I think it's going to offer a real benefit to ladies who like the idea of using something natural in their breasts, and it has the added benefit of removing fat from some place where you don't want it.
There you go. Kind of the best of both worlds, I guess, in a way, right? That's one way of looking at it. All right, you have something new for Botox.
Well, Botox, as you may or may not know, is probably one of the most popular non-surgical aesthetic procedures there is worldwide. It's a great procedure for refreshing your appearance by getting rid of lines and wrinkles that are caused by excessive movement of facial muscles. Botox has had the field to itself for quite a long time. Recently, there was an introduction of Dysport, which is another Botox-like compound. Puretox is the developing product of another company who have just finished their I think they're just beginning their 3rd set of clinical trials. It'll go before the FDA. And of course, the holy grail for these kind of products is to find one that acts quickly and lasts long. Most of the current products may only last between 2 to 4 months. There is some hope that perhaps, who knows, maybe Puretox will up the ante and last a little bit longer. Again, until the FDA weighs in on it, we're only speculating,
absolutely.
But it's hopeful.
Well, once they make the decisions, we'll have you back on here and you can tell us more about them.
Thank
How
you.
about that?
It'd be a pleasure. Thank you very much.
Wonderful to have you. Thank you so much, Dr. Harrell.
Thank you.
And there is plenty more ways that you could learn about these procedures of Dr. Jon Harrell. You can, of course, visit his website, jonharrell.com. He's also on Facebook and Twitter, so you can check him out there. We'll see you after the break.